Good morning, good afternoon, and good evening, everyone. Can you hear me?
Perfect.
Okay. My name is Sabina Sigdel, and I'm the moderator for today's webinar. I, along with Miss Claudia, will be moderating today's webinar. On behalf of One Health Knowledge, so I think I got interrupted in the middle. So the webinar is climate change and health. We know that climate change is a global phenomenon and it has profound impact on human health, including but not limited to increased water and vector-borne diseases, extreme weather condition, physical and psychological effects, and other problems. On the similar note, we have heard of influences of air quality on the COVID-19 pandemic, but its specific link largely remains unclear and unknown. So all these aspects will be discussed by our experts in today's webinar, and hope you will have a fruitful learning today. This webinar is being hosted by One Health Knowledge Café, and this is the third webinar for the year 2021 as a part of One Health Knowledge Café webinar series. So talking about One Health Knowledge Café, this is the collaborative effort of more than 11 individuals representing CIH partners and alumni, and the members are from Asia, Africa, Europe, South America, and North America. It aims to bring together the expertise and network of researchers and professionals from various disciplines, countries, and expertise to enable cross-learning, sharing, and network building. So it has been organizing monthly talks, webinar, online courses, and discussion programs, and it is supported by LMU CIS through DAD Exit program funded by BMZ. So here are the few housekeeping rules. I request everyone to keep yourself muted unless you are speaking. Keep your videos off if you are not presenting, and the session will be recorded and shared. The PowerPoint slide will be shared in the CIH website. We have a Q&A session at the end of all the presentation. So should you have any questions for the panelists, please leave it in the chat box. If time allows, we'll also take questions directly from the participant. Any specific question to a particular presenter, just for clarification, is limited to 2 minutes per 2 questions. So this is our webinar plan. We have got 2 presentations, each will be of 20 minutes. And we have allocated 30 minutes for the Q&A and discussion session at the end of all the presentations. So I'm pleased to introduce our first speaker, Dr. Jennifer Crow. She holds a master's degree in public health from the Department of Occupational and Environmental Health at the University of Washington in Seattle, and a doctorate in public health and epidemiology from the Universität Umeå in Sweden. She served as research coordinator at the University of Washington Pacific Northwest Agricultural Safety and Health Center. Currently, she is a researcher at the Regional Institute for Studies in Toxic Substance and a regional coordinator of the Central American Program for Health, Work, and Environment at National University in Costa Rica. She has served for 7 years as a coordinator of the International Consortium dedicated to international and interdisciplinary research on chronic kidney disease of unknown origin. Her other research interests include workplace heat exposure, antibiotic resistance, and climate change and health. So I'm happy to welcome her for her presentations. Her topic is climate change and health. So over to you, Dr. Jennifer. Thank you.
Thank you, Sabina. I am trying to share my screen. Let's see if it'll let me again. Try again here.
Yes, we can see it. Yeah.
time?
Can you
Okay, great.
zoom in?
Thanks.
Yeah. Yeah.
Okay.
Thank you.
Just 1 second here. So thank you very much, Sabina, and thank you to all of you who have joined from what looks to be a pretty diverse group of countries and places, and I understand to also be a diverse group of disciplines. Just to say a little bit more, I work in Costa Rica, a country in Central America, and there I am at the National University, Universidad Nacional UNA, which is this, and there I work at the Regional Institute for Studies on Toxic Substances, IRET. IRET is a WHO PAHO collaborating center, and within IRET, we participate in the CELTRA network, which is part of the reason that I had the contact to talk to you today. So thank you also to Carolina and Saltra Guatemala for her organization. And am quite excited to be speaking to you today. When I was thinking about what could be said in 20 minutes about climate change and health, I thought it might be best just to focus on some main messages. So what I would propose is that today we look at 5 main take-home messages, and I'll give them from the start. And they are these. Number 1, with climate change, we should expect events that are more frequent, severe, and long-lasting. Speaking of weather events mostly, but not only. Number 2, climate change amplifies existing public health problems. We'll get into what that means. And number 3, not everyone contributes equally to the problem, nor suffers the same consequences of climate change. And number 4, policy requires working across disciplines and agencies and recognizing something called co-benefits, which we will talk about in a moment. And if we have time, or if in the discussion there's interest, we could talk about how COVID is a pretty good example of most of these take-home messages. So before getting too deep into the topic number 1, we should take a look at some definitions. So for the purposes of today's talk, we will use the definition of health that the WHO uses, the World Health Organization, and that is health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And in terms of climate change, there are a lot of ways to understand climate change, or a lot of definitions that are very difficult to understand. But for the purposes of today, we'll talk about climate change is a change in the usual weather found in a place sustained over a long period of time. So when we talk about what can we expect with climate change, and we're talking about extreme events, I think it's important for those that maybe haven't been exposed to this too much to sort of understand how it is that we get to the science that that is published right now about what will happen in the future with climate change. So most of you have probably heard of the IPCC, the Intergovernmental Panel on Climate Change. And the IPCC are thousands of scientists and other specialists who write annual reports, these assessment reports that you see here in the list, that are not reporting their own research, but rather collecting the research that has been published, synthesizing it, and publishing it. And it's important to understand that there are 3 working groups and 1 permanent task force, and then lots of other task force or working groups that come up for special needs. And I bring this up just to say that that in the working group 1, they talk about physical scientific aspects of the climate system. What are these changes that force the change in our climate? And working group 2 is really where we will focus. Working group 2 assesses the vulnerability of socioeconomic and natural systems to climate change, negative and positive consequences of climate change, and options for adapting to it. And working group 2 has a pretty big list of things to undertake. They also look at the interrelationship between vulnerability, adaptation, and sustainable development. Working group 3 is really looking at prevention of greenhouse gas emissions. And then there's a special task force that looks at the greenhouse gas inventories that are used internationally. But I bring this up because if you're looking for more information, or when we say, where do we get this information? Who says how hot it's going to be? Most of the information comes, or at least is synthesized through the IPCC. So then the question really is, all right, well, what will the future look like? And I think for those of you that maybe haven't had much experience looking at these data, it's helpful to sort of take just one example. And so for the purposes of today's talk, just to say, this is a table that comes out of the most recent assessment report and the summary for policymakers. And if you're looking for something that's a little easier to digest, the summary for policymakers is a good place to start. And all of this information is online. In the most recent assessment report, they propose 4 different scenarios. And this is a change from how the IPCC had been working previously. And something called RCPs, and propose 4 different scenarios, and those are listed here. And then they, in this case, in this particular table, are looking at 2 different time frames, one from 2046 to 2065, a 20-year time period, and another from 2081 to 2100. And then really, really important when we look at tables like this is to take a look at what's the reference period for which we are looking at these data, because these are projected changes in surface temperature and sea level rise, but referenced or compared to what? In this case, it's compared to 1986 to 2005, a very recent period. And I point this out because very, very often these tables are published referencing the Industrial Revolution or pre-industrial revolution. So it's very important when we look at these means that we look at, we know what we're comparing to. So as I said, in this case, we're looking at global mean surface temperature change and also global mean sea level rise. And in this particular case, again, referencing the period in the legend here, they suggest that under the first scenario, we might experience a mean surface temperature change of 1 degree Celsius with a range of 0.4 to 1.6. And in the last scenario, 8.5, a mean change of 2 degrees with a range of 1.4 to 2.6. And then if we look at that second time period, that mean again, and then under the first scenario would be 1, reaching up to 1.7, and as high as 3.7 as a mean with a range, a possible range or likely range is what they call it, up to 4.8. And you can do the same exercise with the global sea level change. And we aren't going to talk about that much today, but I did think it was important to point out kind of how one might kind of get at that data if you were interested in knowing it. But again, in addition to kind of the common things that we talk about, which is an increase in temperature, an increase in sea level change, sea level rise, sorry, it is very important to understand that extreme weather events are expected. And there we're talking hurricanes, we're talking droughts, we're talking flooding, we're talking heat waves. And when those happen, they will be or are more frequent, more severe, and more long lasting. So then passing on to our second take-home message, and that is that climate change amplifies existing public health problems. So what do we mean by that? This slide comes from the CDC. It's a free slide. It is available online for anyone to look at. When I started doing this work 10 years ago, there was almost nothing written about climate change and health. And now it's become, it took a while for the public health community to get on board, but now public health understands that climate change is an issue which we have to be involved in. And in this particular slide, which I like a lot, it's the simplest of all the models that I've seen. The rotating 4 items in the middle are forcing agents. So they are, in fact, the weather events, if you will, that we will experience. And this is a topic that's quite complex, but very interesting, they actually influence each other. So as they happen, they can cause changes in the other 3. So we have rising temperature, more extreme weather, rising sea levels, and an increase in CO2 levels and other gases. Those 4 items cause effects in our environment. And in this case, they're taking out a few examples, but we have severe weather, air pollution, changes in vector ecology. So they were talking about things like mosquitoes and other beings that carry disease, increasing allergens, water quality impacts, water and food supply impacts, environmental degradation, and extreme heat. And then in this outer frame are some of the health effects that can be caused or worsened by these environmental impacts. So in the case of changes in vector ecology, we see changes or increases in things like malaria, things like dengue, Lyme disease, chikungunya, and quite a few more. But remember that we said that climate change amplifies existing public health problems. If you take a look at this slide and you notice the different health impacts that we are expecting, none of them are new. They are all things that we deal with currently. They will be made more extreme, or they will happen in communities where they previously did not happen. But it's not as if we have entirely new illnesses as a result of climate change. And that's both good news and bad news. But the good news is that we already know how to deal with these health issues. So then the question really becomes, does 2 degrees make a difference? I mean, you look at that chart and you think, all right, well, 2 degrees might be uncomfortable, but is it really something to be making all this fuss about? And again, we're talking that 2 degrees is a goal, but as you saw in the first chart, we can be talking from anywhere from a 1 degree to a 4.7 degree change in the coming decades. So what I would like to propose is that really when we talk about whether or not this 2 degrees makes a difference, there are two things to keep in mind. The first is, and this is why I put this map on top, remember that the 2 degrees or the 1 degree or the 4 degrees is an average. And so for someone to be at 2 degrees, someone has to be below 2 degrees and someone has to be above 2 degrees. And this map is from the same report looking at global surface change. And it's important there to notice that the distribution of those temperature changes are not equal, and they are tend to be more extreme, quite a bit more extreme, in around the tropics and in the poles. And the other thing that I would say is important when we talk about these 2 degrees is to remember that in public health, we're very used to talking about who are the populations living in conditions of vulnerability or when confronting a particular exposure. And in this case, we're very used to talking about the elderly, people with chronic diseases. We're used to talking about pregnant mothers, babies, and children. I would also propose that in the case of climate change, specifically with increased heat and also with emergency response and similar responses to extreme events, that working populations, healthy working populations, including young, healthy men, are also a vulnerable population. So it's a kind of an interesting twist in the way we're taught to think about things. So then the third message is that not everyone contributes equally to the problem nor suffers the same consequences, which is a little bit what I was trying to point out with the last slide. For me, specifically, the environmental justice framework is helpful for looking at this, or for understanding this concept. And so I decided to include it in case it might be helpful for others, or in case you haven't seen it before. The environmental justice, well, it's really a movement. And in here, I just put a common definition that's used and a sort of description. And so environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And I think that's important because we're going to talk about who is affected and who causes the problem, but also one of the take-home messages about policy. And I think this is very important to keep in mind when we talk about how do we create effective and meaningful policy around climate change and health. So this goal will be achieved. We'll be able to say that we have done this when? Well, when everyone enjoys the same degree of protection from environmental and health hazards and equal access to the decision-making process to have a healthy environment in which to live, learn, and work. And often you see that as live, learn, work, play, and pray. So This is similar to the map that I showed earlier with a different time frame reference, but it's again the change in global temperature, surface global temperature, under two scenarios. So the RCP 2.6 and the RCP 8.5. And again, I just want to make very clear the point that the most extreme, in this case, are the colors that are more purplish, the kind of fuchsia, really are seen more in the poles and more in the tropics. And it's very important to remember that when we talk about 2 degrees or 1 degree or 4 degrees, we are talking about an average, and some populations will be above that average. The other thing that I wanted to introduce, in case you're not familiar with the concept or with the tool, this is a map from a website called carbonmap.org, and the site there is at the bottom. It happens to be in Spanish, but it's in other languages as well. And this is a regular quote unquote map with the sizes of the countries or the continents specifically according to their geographical size. And this is the same map, but looking at the CO2 annual emissions from those countries currently. And often you'll hear countries argue that the current solutions of reducing greenhouse gas emissions are unfair because countries in the global north have already benefited from the possibility to emit whatever and however much they wanted previously. And that is clear in this map, which is the carbon emissions from 1850 to 2011. And then finally, this map looks at under current conditions. This is not under climate change. This is under current conditions, the number of people hurt or that are left without a home or who have to be temporarily displaced or that require assistance in the case or because of emergencies related to either floods or droughts or extreme temperatures under current conditions. And that just to make the point that really again, the issue of what does 2 degrees mean for us as a planet really sort of hinges on this issue of equity and justice. Okay, so finally, the fourth message is that really what do we do about all of this? Assuming we understand the science, assuming we can understand that we are facing public health problems that we already know about that are going to be happening in different populations. What do we do about it? So there, I just want to make the point that really, from a public health perspective, really, and this will make sense to a One Health crowd, policy requires working across disciplines and across agencies. That's become kind of at least here in Central America, then a kind of a popular catchphrase, but working across sectors and recognizing co-benefits. So what does that mean? Most of us are familiar with the terms mitigation and adaptation. Mitigation being what do we do to reduce the amount of greenhouse gases that we have, reduce that change in temperature and sea level rise and all of the other effects that we'll see. Adaptation being what do we do when we're in a population that is experiencing or will experience these conditions. What do we do to change our behavior, to adapt as human beings to those new conditions? And then we have co-benefits, and co-benefits is a concept that the public health community has finally latched onto. And what is that? That is the fact that if policy is taking place about, for example, in a city, the easy example is if my city has decided they want to put in bike lanes because they want to reduce their greenhouse gas emissions because that's been a goal for the federal government, let's say, or for the local municipal government. So they do that. And that counts, right? They get to say, all right, well, we've reduced carbon emissions by so much, or we will during the next 10 years. And that's a good thing. But if I, as a public health person, am interested in, say, cardiovascular benefits, mental health benefits, overall well-being, I want to be actively involved in that climate change adaptation policy. Why? Because the more people we can get on bicycles, the more safe space to be in our cities, the better we're going to have our morbidity and mortality for cardiovascular events, for mental health events, and for overall well-being. And so it's this idea that really there used to be kind of this idea that, well, we really need to advocate for public health, and those people are just doing climate change. And really now it just makes so much more sense to do these things together, because we're all benefiting in different ways from things that are good for human beings and good for the environment. And like I said, the public health community was very slow to catch on to this, but now there is a wealth of information. The Lancet published in 2015 the results of a high-level commission for climate change. And in that report, which is all available online, and they made many slides available for free use, they said that tackling climate change could be the greatest global health opportunity of the 21st century. So really a pretty high mandate. And that's the close, and I'm at 20 minutes, but I just want to say COVID is a good example of this, of how we can expect events that are more frequent, more severe, more long lasting. It is a public health problem. It's one that existed but was highly amplified. It is something in which not everyone contributes equally to the problem, and definitely not from the consequences. And finally, the solutions to it really require working across different disciplines and agencies, and hopefully some co-benefits. So that is my contact information. And after Dr. Lucchini's presentation, I'd be very happy to answer questions.
Thank you so much, Dr. Jennifer, for providing the clear picture on how the climate change has affected us and how effectively we can address them from the public health perspective. We believe that the concept you shared will be very helpful in the development of program frameworks in coming days. So with this, I'm pleased to welcome our second speaker, Dr. Roberto Lucchini.
Hello, everyone. Can you hear me?
Yes. So he received his medical degree from the University of Brescia, Italy, and he obtained his certificate of specialization in occupational medicine from the University of Parma, Italy. So he has been involved in different institutions and organizations. He served as an MD at the Occupational Health Clinic of the Spedali Civili of Brescia, Italy. He was also the professor of occupational medicine at the University of Brescia, also director of the divisions of occupational and environmental medicine at Icahn School of Medicine at Mount Sinai, Newark. Currently, he's a professor of the School of Public Health, Florida International University, and he's also consulting for the Italian embassies in Washington, D.C., USA, and in the Brazil as specialist in occupational health and safety for the COVID-19 prevention and case management. So I'd like to welcome Dr. Lucchini for his presentations. Over to you, Doctor. Thank you.
Thank you very much, Sabina. Can I share the screen now?
Yes, you can.
Can you see right?
Yes, we can see.
Okay, so this is in kind of a follow-up topic to Jennifer's talk, and this is more focused on COVID-19, but also is related to air pollution and meteorological factors that can affect the incidence and the mortality from COVID-19. I think it's a good example in public health where we focus on environmental factors, including meteorological factors, and we sort of try to put everything together in a sort of a holistic approach, trying to see how these different factors can interplay with health outcomes of different things. And in this case is COVID-19, but it can be many others examples also of chronic diseases and acute disease and acute health impacts as well. So this is basically a study that was done in Lombardy, Italy, which is the northern part of the country. And I mean, it has been hit by COVID very badly. And I was born in this region in northern Italy, and I'm especially in occupational environmental health. I've seen so many workers in this area with silicosis and work-related respiratory diseases. This is core industrial part of the country since the last century. We're talking about mines and steel work, and so a strong industrial production, but also the same way occupational and environmental exposure to airborne particles in general. So when I was like everybody else wondering why certain areas of the planet are being hit more than others, this particular one to me was probably had something to do with the exposure to particulates, and so that's why I put together other colleagues in Brescia in Italy, and we sort of try to address this problem to understand whether previous exposure to airborne particles can basically provide some, determine vulnerability to the disease severity, and also for mortality and disease progression as well. So we could not, of course, address all these questions because it will take time, it will take energy and resources to do these kinds of things, and hopefully they will become available. But right now we felt the urgency to address this problem as quickly as possible. And we did something that many others have done and are doing all over the world, which is ecological studies. Ecological studies, they
Excuse me, Roberto. Sorry
Yeah?
to interview. We are still on the first
Sure.
slide.
Oh yeah, I'm still there.
Yeah.
I'm sorry.
Thank you.
I know. It's just that, yeah, sure. I'm sorry, Sabrina. I was saying that I was introducing what we did basically with the logic of using ecological approach, which is basically using the available data, publicly available, to address a problem in a way that obviously is not accurate as it can be with a cohort study or some epidemiological study based on individuals. This ecological approach is based on communities, on municipalities, on counties, so geographical entities that mediate a lot of factors. And so therefore, there's a limitation here, but as well, it's of course much faster and than a cohort study, and much cheaper. So anyways, we follow that approach and trying to provide indication whether our hypothesis of vulnerability created by exposure was real. And so we sort of fit into an emerging, increasing literature on this environmental exposure to PM 2.5 and PM 10, increasing literature showing that airborne particles may facilitate the virus diffusion. This is controversial, I must say, but also increase the risk for COVID-19 disease severity, progression, and mortality. There are good reviews in here. I didn't have time literally to include this, but there's a very new report from the World Meteorological Organization, not the WHO, but the WMO. So the World Meteorological Association, depending from the UN as the WHO is, has done this nice report addressing the importance of this factor, meteorological and air quality. And actually that report is another additional, very recent tool for you. I will provide the link because it just came out a few days ago. And that's another important actually source of information that increases and summarizes all this literature. I mean, it started from Asian cities showing basically higher mortality for COVID, considering both PN 2.5 and PN 10, but at very, not but at a quite high exposure level in Asian cities. So that was basically multivariate analysis, I must say. And that was the initial way to address this topic. And in multivariate analysis, of course, there is a lack of information of all the other factors that are important in this context. But still, it was important to as a starting point. And here we go to Lombardy. Here is in the north of Italy, and here is a timeline of the COVID mortality rate. That this is 2020. So from February to March, and to March, you see this incredible increase of incidence rate. Basically, with the start of the epidemic in Italy, and especially in this northern part, and also of mortality. So talking about mortality, we use all-cause mortality. We don't really use COVID-19 mortality because we prefer basically to use the overall mortality because it's largely weighted on COVID in this time, unfortunately. And so the question was that, sorry, I have to plug the computer in. And see, this is the representation of the incidence rate that goes here in this part of the region where the industrial activity has been, as I said from the beginning, historically highly represented. So there is a sense here of a geographical connection, not that accurate one more time, because it's based on those geographical representations of municipalities. So each municipality mediate a lot of variability, but still it's important that in the long term, you use this data to have a sense of what is likely to be happening in certain areas. Highly concentration of industrial activity, of urban air pollution, high incidence of the disease, high mortality rate, and this is what we try to address. Actually, in our study, we made this effort to include a lot of other potential cofactors that are known or suspected to play an important role in COVID-19 statistics. And therefore, we use publicly available data for each municipality. Not an easy work because you have to do a lot of research in this on this publicly available data. You need to ask for permissions, etc. So, but in the end of the day, we sort of came up with I think the best proxies that we could have in terms of income per capita, education, house crowding index, average family size, proportion of population over 75, sex ratio, population size and density, number of beds in nursing home, distance to the closest hospital, and these other factors, like to have a sense of entertainment and sources of aggregation. Unfortunately, this plays a negative role because people want to relax, want to socialize in Italy and in everywhere. And that was a negative factors, unfortunately, measured and quantified by these numbers, like a average number of employees in bars for each municipality. And still, again, average number of restaurant, catering, health and social assistance, entertainment, recreational activities. So all this data basically was an effort to include as much as possible other data in this analysis, and then we had a lot of meteorological factors, temperature and humidity over many years that we could use, and we did a lot of modeling. We did an intense work here to look into recent exposure, historical, average annual. So in the end of the day, we used an average annual PN10 and also PM2.5 and NO2 to have a sense in the last 4 years of the average sort of cumulative recent exposure to this airborne pollutants. And I must say that it was an important work that we did, and at the univariate analysis, as you have seen before from the Asian studies, again, there is an association on with the basically all sort of recent or historical or even the pre-lockdown concentration that we had right before the start of the epidemic, January, February, and we saw an association also with that very recent data. We do not have elements to say that there's an acute exposure. We are sort of more inclined to think about a chronic exposure that can sort of decrease the immune response, especially causing a vulnerability for the respiratory function. So that was the univariate and the basically with the multivariate, it came out very clearly that both the PM2.5, PM10 were basically associated to the outcome of the incidence rather than the mortality. But basically, this is a strong result that we finally published because it's actually showing that there is an association with the incidence of the disease and the mortality, also after including all those possible other cofactors. So we think it's a strong indicators of the possible association with the pre-existing exposure to airborne particle. Of course, we did some estimates, and these are important because based on estimate of an increase of 1 microns or 10 microns per cubic meter, we were able to estimate 18% of potential increase of the incidence rate, 3% increase of the mortality. These are important estimates. This is an important work. Of course, it is an estimate, and it cannot be extremely accurate, but it's an important public health message. Here, I want to reconnect with Jennifer. I mean, these works are important because this is a USA study from Francesca Domenici's group in Harvard, and they basically did a similar work, including all the counties in the United States. It's not only the municipality in the Lombardy region, which is probably smaller than one county in the US. But anyways, the sense is the same because it came up with a very overlapping results in terms of the increased risk of the disease. So this is, of course, these percentages are representing modifiable risk. That's why are so important in terms of potential public health intervention. The knowledge of this is very important, I believe. Of course, as I said, there's a need for further studies because we have to confirm this data, not only with ecological studies. I think that now there's enough evidence based on that, as the WMO report is reporting. But there's a need of large cohort studies getting more into the fragments and the details of factors like the comorbidities. We could not really have a sense of how the comorbidity plays a role in our design because it's difficult. Also the colleagues in Harvard, I think they didn't really came out with the indicator of comorbidities based on counties or municipalities. As you can imagine, there's a huge variability. So the cohort study is crucial and is needed also to look into genetics and epigenetics and omics and all sorts of things that can play a more defined role in terms of mechanisms. I just want to quote this work here that is trying to find potential mechanisms linking exposure to airborne pollutants and biological agents through some mechanisms that creates immunitary deficiency through certain molecular pathomechanisms that are hypothesized, but this is another fundamental work to try to understand this better. And this is a representation of how anthropogenic pollutants and viruses, they could target the immune system in a similar way. Of course, it's a start, but I think we need to go further in that direction. I would like to stop here and listen to your comments and questions. Thank you.
Thank you so much, Dr. Lucchini, for your very incredible presentation and sharing very important findings from the research work. So with this, we have come to the end of all the presentation. Now we will move on to the Q&A sessions. To lead the Q&A session, I would like to request Claudia to lead the Q&A session. Over to you, Claudia, for the discussion session.
Thank you. Thank you, Sabina. This is Claudia Meneses from Guatemala. First of all, many thanks for those two excellent presentations from Dr. Crow from Costa Rica and from USA and right now in Costa Rica. And then thank you for Dr. Lucchini from Italy and also now from USA. You really showed us in a very summarized way that we have to work a lot in climate change, in pollution, in order to improve the public health conditions that we all want to improve. So I would like to ask Dr. Crow, that you mentioned, Dr. Crow, that COVID-19 was a very good example of climate change effects in health. Can you go deeper into that example, Doctor? And also, we have another example very clear in Central America about other effects in public health that are related to climate change.
Sure. Hello, Claudia.
Hello, Jennifer.
Saludarla. So I think what Dr. Lucchini's presentation is spot on in terms of a good way to think about why COVID, although it is not uniquely or directly necessarily from climate change, is very much something that we can and should look at under the lens of climate change. And his presentation is exactly it. There's a lot of things that are kind of teeny tiny, right, that are hard to sort of demonstrate, and it's impressive that they and others have been able to do that. That tie into those 4 take-home messages that I included in the presentation, and the one that sticks out the most for me, and I think was clear in Dr. Lucchini's presentation, was that, you know, the folks that are dealing with air contamination, PM 2.5, PM 10, are not usually the wealthy populations. Usually it's poor populations, industrial towns, that kind of thing, or living, you know, next to a major roadway or train or something along those lines. And so it goes back to it being an environmental justice issue, right? Which is why I wanted to point that out. And the other thing that I think is that COVID has made very clear is, you know, the public health community for a long time has been saying that there's going to be a pandemic, there is going to be a respiratory disease that will affect us, we have to get ready. And it's very easy to sort of let that slide. And I heard someone, actually, Georges Benjamin from the American Public Health Association, say the other day on a website he said, I don't say this very often, but I don't like to say I told you so, but we told you so. And he said, I feel the same way with climate change. We've been saying this is going to happen. We've been saying it's going to get worse. We've been saying we need to prepare ourselves in an intersectoral, interagency way, interdisciplinary way. It's time to do that because now we've seen how bad things can get and how bad they can get fast, right? And in terms of your other question, Claudia, about Central America specific, the example that I'm most comfortable with is heat, because that's where we've done most of our work. And so heat is another good example of something we started studying specifically in working populations. Exposure to heat, which comes from the metabolic load, the exercise you do while being at work, but also the environment. Under current conditions is a problem. And that's why I said often that I like to, or I think it's important to think of young working men as a vulnerable population when we talk about heat waves or a gradual continued increase in the average temperature and the high temperature during a certain period of time. Why? Because we know that workers, specifically sugarcane workers, but also other workers have been shown, are working at their physiological limits in many cases under current conditions. And so under current conditions, they suffer heat effects, or health effects rather, that range from things that are uncomfortable to things that are very dangerous to golpe de calor, or heat stroke, which can be a fatal outcome. And so when we talk about a 2-degree increase, that's when I get concerned about working populations, because we know that here in Central America, and I have no doubt that in other parts of the world, especially in the tropics, there are populations working at their physiological limits now. And so a 2-degree increase is really important and something we have to pay attention, both in terms of heat waves, which is a sustained increase for a certain number of days and what we're used to in that particular time period of the year, as well as increases in the average temperature and the high temperature of a certain place during certain months of the year.
Okay, thank you, Jennifer. There are only two very good examples of what can happen if we are going in the same way with pollution and all the causes of climate change. Thank you, Jennifer. And we have here a question that can go to both of you, also for Dr. Lucchini, and I'll ask him to answer first, and also Jennifer, if you can comment later. As most of us from the audience are from countries that we have very poor health systems, and that also we are very vulnerable countries regarding to climate change. What do you suggest as appropriate strategies for our countries so we can respond effectively and also on time, if that's possible, to some of the climate change challenges that we are facing right now, so we can as public health actors, we can have some incidence in how the authorities are dealing with these problems, especially with COVID. Dr. Lucchini, can you start?
Yes, Claudia.
Thank you.
Excellent questions. Excellent questions. Well, my personal take on this very important part is definitely communication, partnership, collaboration, continuous talk between us. That's, to me, is the fundamental point, because it all starts from this. We are the persons who are more experienced or less experienced. I see some of my students in this that came to attend this webinar. Of course, they are not experienced, but they are interested. So I think it's fundamental, Claudia, to me, to sort of increase a lot communication, partnership, collaboration, because this is fundamental. Together, we as scientists, as public health advocate, etc., we can definitely exchange ideas, experiences, and it's only, to me, not the only one, but it's a basic win-win situations where basically you mentioned I mean, more, let's say, poorer countries versus other countries, and it's true. Of course, we are all well aware about this, but let me tell you, also within the developed countries like Italy, and also the US, there's underdeveloped and underserved populations. It's not all equal. I think that's there's a lot of common things between all parts of the world in this public health arena, and therefore communications between experts and the interested persons, it's fundamental to me. It's really fundamental. I think it is one of the most important drivers, because together we can there's always a need for funding. There's always a need for resources, because we can stay here and talk about hours and hours. Of course, as I said, in my case, for example, ecological assessment. Well, you need to be good with the internet, good in trying to find the available data, since it's not that obvious. You need to do that kind of search, etc. You need people to do modeling, of course, statistical advances, modeling and statistical approaches to work on the data, trying to understand what the data are telling you. But that's a lower cost, obviously, compared to something that is clearly needed to understand this better, which is cohort studies with environmental measurement, biological, biomarkers, meteorological data, finalized to each individual participant of a cohort. That takes a lot of funding and a lot of resources. So that's to me a call for everybody interested in this important contribution in public health to partnership.
Thank you, Roberto. Of course, that's the main point, to conduct more research, so we can move from theory to practice, right? And Jennifer, yes, Jennifer.
Claudia, sorry if I keep talking, but for example, in this case, our publication, I just sent out a link, but with this publication, as a scientists, we can deliver something to the regulators in northern Italy, okay, and in this municipality, so that they know that there is some scientific evidence, not only from us, but they know that this is important. They know that they should work more on the exposure reduction. But we need to provide them, of course, scientific evidence as much as possible.
Okay, thank you, Roberto. You can find the link to the publication that Roberto is talking about in the chat box. For all the audience, you can find the link there. And I'm asking Jennifer if you have something else to comment about the strategies that our countries can have in order to improve this challenge that we are facing right now.
Well, I think it's a good question, and I think Roberto is completely correct on everything he says. And I think for me, that's why the concept of co-benefits is so helpful, because if you're a scientist that does research on particulate matter in the air, it's easy to say, well, COVID's not my issue, and climate change isn't my issue, and the funding's all going to COVID, and the funding's all going to climate change. but really there is a possibility, and the example we saw today is exactly it. You know, where can you contribute from your area of expertise? And let's be honest, you know, if it's your area of work that you're assigned to at your university, at your hospital, at your whatever, you know, sometimes we're only allowed to work in those boxes. And so figuring out how to do that in whatever is the popular topic or the funded topic or the necessary topic at the time, I think is very, very key. And to not be afraid of crossing those boundaries and saying, well, you know, I do public health, I've never done climate change. Well, we can learn to do this, or I do contamination, I do pollution, I don't know anything about COVID, and figuring out how we can contribute. And I should take advantage of the last question that I answered. I see Dr. Ineke Wessling is online and pointed out something that I forget is an obvious. She mentioned a disease called chronic kidney disease of non-traditional or unknown origin, which we have in Central America, which is linked to heat exposure in working populations. And it has been postulated that is an example of an illness that is made worse by climate change, by these increasing temperatures, which is why I brought up the temperature issue here in Costa Rica and in Central America generally.
Okay, thank you, Jennifer. And we have another question for both of you.
Can I, Claudia,
Yes.
Can I just make a quick comment trying to link Jennifer and Ineke Wessling comments on chronic kidney disease? I mean, I just read another report showing that patients, COVID patients, they show increased acute kidney injury. So, you know, and this is actually potentially linking what Jennifer was talking about, the exposure to climate, etc., to some superimposed exposure to the virus, where the virus could have a tropism in the kidney. So therefore, you may well have workers exposed to temperature, etc., and to the virus with okay, unfortunately, 2 or 3 or more factors that are targeting their kidney. And so just I wanted to mention this as another sort of circulating comment.
Okay, thank you, Roberto, for the comment. As we have a lot of young people in the audience from many universities all over the world, we have another question for both of you. That is, what do you think potential research areas would be advisable for our countries? We have in the audience people that are interested from countries as Germany, for example, but we also have people from another group of countries, from low and middle income countries. So maybe you can talk about both kind of countries. What do you think potential research areas would be very good advice for us, for the both high income countries and low and middle income countries? Maybe Jennifer can go first.
Sure. I do think that the advice to anybody starting is to do something you like. And so I don't think it's advisable to say, you know, I'll do this because it's popular right now, because now we all know that a pandemic or some other extreme event can happen and the popular or the funded topic changes very quickly. And because I also think that you can use your expertise and all those expertises that Roberto mentioned that are, you can apply them to whatever is the hot topic at the time. Regarding climate change, most countries have what's called a national communication plan related to climate change. And so most governments, and this is especially true for countries in the global south, have set goals and have sort of set out kind of what their current status is in terms of adaptation and mitigation and kind of where they want to be. Those get turned into the UN. And if you want to be doing climate change, it is a very good idea to know what's in your country's national communication plan. They are online, and this happened when we first started doing heat and climate change work 10 years ago. There was nothing written about heat and climate change. Well, then you start talking to the people who are who have the possibility to do research, because you have to remember, you have to get research published before it's included in those IPCC reports. And so it's a really good idea to talk to people in government agencies, and many times they are looking for help. They're looking for someone to strategize with them. So if policy is your thing, or even if you're more on the science side of things or the health side of things, and you just want to see maybe where those areas are where you could collaborate or find collaborators, I think the national communication plans are a good place to start, and that would be true for almost any country.
Okay, and can you repeat, Jennifer, where can the countries find their national communication plan? And every country has to have their own communication plan?
Correct. Well, not most countries do, because it's linked to funding that comes from the United Nations climate program. I'm forgetting another word in there. I'll try to look for it while I can, and if not, I can send it to you later, Claudia, to send to everyone. But generally, Googling United Nations climate and national communication plan, oftentimes they're outdated, and that's certainly been the experience in these parts. But it's a good place to start, and you'll see kind of who the people are. And it might be that the collaborators from your country are from the Meteorological Institute or whatever happens to be the body that looks at weather in your country. But it might be much more specific, looking at greenhouse gases, or it might be looking at putting bicycle lanes in. It's that kind of specific actions, and you'll see names in there. You'll see departments of institutions where you can pick up the phone and call or send emails. And my experience, at least, has been that the people who are doing climate change work are looking for people who want to get on board.
Okay, thank you, Jennifer. Roberto, you have something else to comment?
I'm not as expert as Jennifer in terms of climate change, but I would say that to me, an interesting, potentially good environment where north, south, or whatever we want to call it, colleagues can older and younger and etc. can meet and exchange their ideas, etc. Might be the global health environment or groups or associations. I mean, I think the global health it's a nice opportunity for scientists and public health and governmental and industry, private contributions to meet and talk. There's a lot of groups and associations in global health. I think that global health spans from infectious diseases, but now also there's a I think it's growing also the global health part regarding occupational and environmental exposure. So all these things are kind of, to me, finding a potentially a good place to increase communication and networking. Network is so important at the end of the day, because just as I said, through this, people can find ideas, can find links, can join groups. In my experience, I'm not doing research on for example, on CKD. I wish I could, but from what I understand, in that example, I think that joint forces, building consortia, merging data, merging samples is fundamental, because now when we try to study this these public health problems, can be COVID, can be the temperature, but our approach is more and more multidisciplinary, is more and more holistic in a way. So what does this mean? It's true, we have to do this, because we need to consider all possible factors, and we need to consider how do these different factors interact with each other. I think that when I started years ago, I used to be in toxicology, and toxicology classically was, all right, let's study lead exposure or mercury exposure or manganese or other things. And I still remember that the approach was one by one. You study that exposure by itself. But in the real world, in the real workplace and environment, all these factors are present at the same time. There's temperature, there's agrochemicals, there's a virus. So you need to be able to approach them all together. And to do this, becomes very complicated, because a lot of effort financially, but also intellectually. You need to have very good systems in place to aggregate people, to aggregate data, to aggregate samples. You need to have very good digital IT background to manage all this, quality control of the data, data management. It's really becomes more and more, rightly so, becomes more complicated, because you have more data that you're using at the same time, genetic, epigenetic, nutritional, stress related. So it's important to do this, but it really requires large groups. It will require more and more collaboration to build this type of systems where you have large, sufficient power to address these factors and understand how do they work together, so that your risk assessment can be more accurate, and one more time, you can deliver scientific knowledge to a political level, so that this can be translated into action, but with a much more accurate precision, and just because you really want to address all the factors, not only one or two separately, or the univariate. I pointed out the example of the univariate. Of course, it's the first way to analyze something. You have the exposure, you have the outcome, see if they are interrelated. That's okay. But then you also need to consider many other factors. How do they interact with all this? And that's where everything becomes more difficult, more challenging, but more accurate in the end.
Okay. Thank you, Roberto and Jennifer. So I think we have now two very useful tools that we can use in order to initiate some research in our countries. The first one is the national plans that Jennifer commented, and she has written the website of the national adaptation plan, so everyone can find them in the chat box. And the other tool that Roberto commented was to conduct a risk assessment. I understood in each one of our countries, because we have different situations, different conditions, and the results of that risk assessment could lead us to what the needs of research are in our countries. Thank you. And we have now some minutes to ask participants from the audience if they want to conduct some questions directly to the speakers. If you want to do some, please unmute yourself and you can raise your hand and go with the question to Jennifer or to Roberto, please. Okay, meanwhile, someone raised their hand. I will ask the last question to Jennifer and Roberto.
There is Ineke raising the hand.
Okay.
Yes,
Ineke,
sorry, I had
good
problems.
morning and welcome. Can you go on, please?
Good morning to everybody. Very nice presentations, really nice, and in such an important topic. Now, I just wanted to extend a little bit on the CKDU. I think Roberto's example of COVID and air pollution is extremely important. But also the CKDU or CKD&T, non-traditional origin, as Jenny rightfully said. It's an epidemic disease that we have seen in like in a sentinel population, sugarcane workers, but it's also present in many other occupations where people work under very hot conditions and have very strong manual labor, construction, mining, salt workers, well, etc., etc. So we expect that this will extend in the future with the warming climate. And the thing is that this is preventable. It's an occupational disease. And I don't know, Jenny wants to extend a little bit more on that, but in La Isla Network, one of the two organizations where I work, we have done interventions in sugarcane, and we have shown that by reducing the heat stress to which workers are exposed, we greatly diminish the kidney disease. So it's an important example of how to, well, adapt. I would say this is adaptation. And of course, it's a double cause, not just the climate change, but also work organization and things like that. But it's preventable.
Okay, thank you, Ineke, for a very good example of occupational disease that we are facing right now in Central America and also in other countries of the world. That is very, very well related with heat and climate change, as Jennifer told us before. And before we end, I would like to ask Jennifer and Roberto if they can share with the audience one take-home message that we can take home and move a little bit from theory to practice in each one of our countries. Roberto, can you go on, please?
I would just reiterate the point of communication and the exchanges. We can definitely take advantage of this electronic media now, Zoom or Teams or whatever we want, and take advantage of this kind of relatively easier communication tool that we have. Of course, nothing can beat in-person interaction. That's for sure, because it's the best. But in my experience, also with training and education in different parts of the world, I think that the communication, creating networking and link between different people from different parts of the world in a multidisciplinary approach, it's always beneficial because it will create opportunities to develop work together. That's for sure.
Thank you, Roberto. Jennifer?
Previous, just to comment on Inike's comment, for those that are maybe from more of an occupational health background, Ineke called it a sentinel population, and there's a saying, right, that the occupational health is a window to environmental health, and that is that we'll often see see a disease in a population, in an occupational population before we see it in the general community. And that is why CKDU is such a good example of something that we can see right now in a working population, and that we probably can see, might be able to see if we can look for it now, and we'll probably be able to find in the future in a wider population. And the other thing that I would say about that is just to reiterate what I said in the presentation, and that is, yes, there are ways to make working safer and to prevent CKDU, but I also think that in some cases, at least in Central America, we have workers that are at their physiological limits. And that's why I get nervous about this, the 2 degree. That's why I said is 2 degrees too much, because we don't know what the physiological limits of adaptations are for human beings. So I think maybe with climate change, and certainly with heat waves, there have to be additional protections in place to make sure that when a population is particularly unexpectedly exposed to heat, and this goes for any part of the world, this can happen in the global north very, very easily, and does, heat is a very real risk. And so when those things are happening, those things being heat waves, more frequent, longer, and more severe, we have to be, that's a climate change policy, not necessarily just a workplace policy. And so that's, I think, and that ties into what I think would be my final message, which was also Roberto's final message, is that we need to be working across disciplines and across agencies, and to really, especially for the young folks, not to be afraid to pick up the phone or send an email to somebody whose name you see in a report somewhere. I really feel strongly that folks working in the climate change world right now, and even in the COVID world right now, are looking for people to accompany them. So I would just not be afraid to send out some emails and see if you can help in some way or learn.
Okay, thank you, Jennifer, and thank you, Roberto. So this multidisciplinary approach of climate change is important. I think that's the key, that we as professionals from different backgrounds can learn to talk the same language and begin to work together. That's very important. So we can deliver scientific evidence to the public policies, health makers. That's very important, and that's, I think, going to happen if we as scientists can work together in different disciplines, like in multidisciplinary approach. So I will say thank you for Jennifer, and thank you for Roberto. As always, you always go with excellent presentations, excellent data, excellent facts. So thank you for your participations. And I'll handle it for Sabina for the closure of the seminar. Sabina, please.
Thank you, Claudia, for moderating the discussion session. Thanks to our speakers for sharing their insights and thoughts on different topics. The discussion went very well, and there were a lot more to learn from your discussion. Thank you so much. So with this, we have come to the end of the webinar. Before we wrap up the session, I would like to provide a few information on the upcoming webinars. So we have more of this webinar in the coming month. So we have planned for webinar in April, May, and June on different topics. So the audience can visit our CIAT's website for the announcement and the speakers. So with this, on behalf of One Health Knowledge Café, I would like to thank all of you for taking your time to join with us. Special thanks to our esteemed speakers for sharing your thoughts and insights. Thank you, participant, for your active participation, and thank you to One Health Knowledge collaborators, and thank to Center for International Health, and everyone. So I would like to inform that the PowerPoint slides and webinar recording will be made available in the CH website, and we'll also share with you the link in the respective emails. So with this, I officially would like to announce the end of this webinar. Thank you, everyone. Have a good day. Stay safe. Thank you.